Hey everybody, welcome back to episode 12 of our anatomy focused laser series. We're going to start exploring the spine. I'm going to break it down section by section, as I think we're all quite familiar with those different sections, but what do they actually really do? So we have our cervical vertebrae first, so that's C1 to C7. And it's all to do with that head and neck mobility, that postural control, that falling motor and sensory pathways via the brachial plexus. And it has some really unique structures, particularly kind of the C1 and C2. So C1 is known as the atlas, and that's in control of that flexion and extension pathway. So that's our yes movement there. And then C2 is our axis, and that's more in control of that rotation, that no movement there. It has a very high spinal cord density, which has very high clinical impact. And common signs, if we have injury within our cervical vertebrae, neck pain, reduced range of motion, I can never say this word, tetraparesis or ataxia, those proprioceptive deficits, altered reflexes, possible respiratory compromise. So that cervical vertebrae has a lot of impact if we have any damage there. Our next section is our thoracic, and this is T1 to 13. Its main function is trunk stability, rib articulation, that sympathetic nervous system outflow, particularly T1 to L3. And its key structures, we have really long dorsal spinous processes. So these are lumbar, but these transverse processes here are really quite elongated. It's less mobile than kind of other areas, particularly that cervical, but it's highly stabilizing. So it's keeping the body in the shape that we need it to be in. And if we, if we have any impact to our thoracic vertebrae, signs that we tend to see, particularly hind limb ataxia and paresis. We get increased pelvic limb reflexes, truncal pain, reduced postural reactions, and possible, I can never say these words, autonomic effects. So heart rate and GI motility. Gosh, too many big words here for me. So again, it's another section that has a totally different impact. And I think that's what's quite cool about the spinal anatomy, is that depending on which segment is impacted, has a totally different effect on that animal or on that patient. So it can help us identify where in that vertebrae we think there's an issue. So then we come on to our lumbar vertebrae, and here we've got L1 to L7. And the function here is weight transfer and that propulsion forward, pelvic limb motor control. We have the lumbosacral plexus, and that's between L4 and S3. Its key structures, it's got larger vertebral bodies. It's a very common site for obviously IVDD, particularly L2, L3, L4, L5. And if we get an impact here, clinical signs tend to be hind limb weakness or paralysis. We get altered spinal reflexes. We get reduced tail tone, and we get pain on extension or upon palpation. So again, a bit of a different area. So maybe not quite as significant impact as maybe cervical and thoracic. That could be debated, but again, very different area. So then we move on to our little sacral even, and sacral is S1 to S3, so it's a really tiny segment, and its function is all to do with that pelvic region, so particularly the organs there. So we've got the bladder, we've got bowels, we've got sexual functions, and it's that tail base and pelvic limb innervation there, so everything that's going on within that area. Its key structure, so again this is a bit interesting for this section, is that those vertebrae are fused, so you haven't got the mobility that we have in the rest of the spine there, and it has very key element to the parasympathetic outflow, which is that pelvic nerve, so really important nerve there. And if we get impacted here, of course, naturally it's going to impact urinary or fecal incontinence, reduced anal tone, tail paresis, and obviously lumbosacral pain. So again, different signs, symptoms, which is really key when it comes to then where do we laser in the spine. It's all these key points that are really, really important to us. So then we have finally the coccygeal region. So the caudal coccygeal spine, the function there, tail movement, communication, minimal locomotor role. You know, it doesn't really impact that kind of movement as much as the other areas. Key structures here, you know, variable number of vertebrae. You can have someone with a really tiny tail and some with really long. It has very limited spinal cord involvement generally, and clinical signs, if this area is impacted, is that tail paralysis or pain, and usually no limb deficit. So this one again isn't quite as important as our others. So that's where we're going to be starting from with our spinal segments of this series. The pun there. In the next video, in episode 13, I'm going to start looking at the breakdown of the actual vertebrae and the nerves that impact that spine. So stay tuned, and I'll bring that episode to you next week.